What is COVID-19? COVID-19 is a disease caused by a virus called SARS-CoV-2. This virus mainly spreads through tiny droplets from an infected person when they cough, sneeze, talk, or even breathe. It enters the body through the nose, mouth, or eyes and affects the lungs and other parts of the body. COVID-19 can cause mild, moderate, or severe illness. Common symptoms include fever, cough, shortness of breath, tiredness, sore throat, loss of taste or smell, body aches. Some people recover quickly, but others, especially older adults and those with health problems like diabetes or heart disease, can get very sick. In severe cases, it can cause pneumonia and breathing problems, leading to hospitalization. How to avoid COVID-19? The best way to avoid COVID-19 is to take simple preventive measures to stop the virus from entering your body. Wash your hands with soap and water for at least 20 seconds. If soap is not available, use a hand sanitizer with at least 60% alcohol. Wash hands before eating, after touching surfaces, and after coughing or sneezing. Wear a mask. Masks block the virus from spreading through droplets. Wear a mask in crowded places, public transport, and hospitals. Ensure the mask covers both your nose and mouth properly. Keep distance, social distancing. Stay at least 1 meter, 3 feet, away from others, especially if they are coughing or sneezing. Avoid crowded places like markets, buses, and large gatherings. Avoid touching your face. The virus can stay on hands after touching contaminated surfaces. If you touch your eyes, nose, or mouth, the virus can enter your body. Keep your surroundings clean. Disinfect surfaces like tables, door handles, and mobile phones regularly. Keep rooms well ventilated by opening windows for fresh air.